My real preference for microcatheter is for tapered, branded microcatheter. I like supportive microcatheter. Okay, so I know that it's very good to have low-profile microcatheter because you can cross some very tortuous, tiny collaterals. But then when you are in front of the distal cap or in front of some calcification or stenosis, then the low-profile microcatheter give you not enough support to puncture the distal cap and to progress inside the CTO segment. So that's why my best microcatheter is not a low profile, it's a supportive microcatheter, so it's 2.6 French, and I like also the rotative microcatheter, okay? And then I can advance my microcatheter more easily without less friction, and for me this is my preference for the microcatheter.
Regarding microcatheters, it's most important for me for anterogate cases is to have good support, good balance of support, good balance of crossability, torqueability. So in most of my cases, anterogate microcatheters are coiled microcatheters with good torqueability, with a lot of spinning force. The tip has to be not so fragile, but also tip entry point should be smaller. So construction of the tip is very important, of the coils, and visualization of the microcatheter is very important. So most of the microcatheters coiled have tungsten tip, which is good visible. Regarding septal collaterals for retrograde cases, even though very small profile microcatheters are more and more available, when you have CC2-3 collaterals, it's regarding to retro support, it's also good to cross with the supportive bigger microcatheter, in my opinion, for have bigger support for example a reverse guard. And it's nice that today we have a long microcatheter available, more than 150, 170, 165, and even we have coiled microcatheter 170. So for some long septal or epicardial or septoepicardial collaterals, we don't have to use short guiding catheters because we have long enough microcatheters. And for epicardials and complex tiny septals and some other complex, we have broad spectrum of very tiny, very atraumatic and also nice catheters from 1.7 French up to the 2.1, 2.2. So those microcatheters are important to be the tip, atraumatic tip, not so long tip that, and for especially for the retrograde microcatheter is a very important inner layer of the device. So bench testing and in vivo testing of various wires, special long wires, RG3 and R350, which are very important for us operators to have slippery inside lumen of the microcatheter for much easier externalization, because in that very long lesions, very long microcatheters, we are often dealing with high friction of the wire. So it should be very good to have very slippery inside lumen of the microcatheter. Also markers for visualization. I'm using E-long with 2 markers or 3 markers is much better in my opinion, because I'm using low frame rate and to reduce radiation, and sometimes it's really hard to see, but we have this issue with all the microcatheters with single markers. So I think adding of the additional markers is very good to have in this very tiny microcatheter. So those are good ideas to implement in the future devices.
I think there's no a perfect microcatheter. You have a perfect microcatheter for each lesion. You know, we have the CTO is a procedure that changes a lot during the procedure. So of course you need a microcatheter that navigate. You need a microcatheter that have the best support as you can. You need a microcatheter that the material wires navigate inside as best as it can. So insist We had different kinds. We had the straight microcatheter, the tape microcatheter, and all of them, it should be the best for each lesion.
I could not say I have a preference in one microcatheter because it depends on the type of CTO that you are going to treat or the technique, the CTO technique that you are going to use. There are several options, very different microcatheters, and I think that's good because the operator can choose among one and another depending on the CTO characteristics. So right now I think there are quite enough different microcatheters. I'm happy with the options that we have. Maybe we can improve a little bit, but right now the evolution of the microcatheters in the last few years it has been amazing, and I am very happy with the tools that we have available right now.